Well, I feel pretty safe with the guy that is letting me stay in his camper because, you know, he doesn't put up with stuff from people. And I feel pretty safe because there's two of us.
And if you're talking about sleeping on the street or in a shelter, far fewer women actually sleep on the street because there's so much violence. There's actually so much violence in a lot of these different situations, but particularly on the street.
Being on the street for women makes them extraordinarily vulnerable to violence because there's so much street violence, and so often a woman will sort of hook up with someone to protect her, and then often the very person who's supposedly there to protect her will begin to get very controlling and violent and will also abuse her. So it's sort of a choice between being with someone who is violent and controlling but will protect you from strangers and other assaults on the street versus being totally on your own on the street and open to assaults from everyone.
I feel pretty safe. I don't know how, you know what they say in the 12-step programs, feelings aren't facts. I'm not sure why it matters if I feel safe or not.
Well, it does affect your stress level, which affects your health.
Well, yeah, okay. I'll email you from the hospital next week.
Definitely, if you don't have a place to sleep and if you don't have food, your choices are going to be very different than if you did. Overall health status, the unmet subsistence needs is a stronger correlate of overall health than adherence to antiretroviral medications.
And by subsistence, you just mean food.
A place to wash, having a bathroom, enough food, enough clothing, and a safe place to sleep. We've had two phases of our study. The first phase, we were just following only HIV positive folks, and now we're following both HIV positive and HIV negative. When we were following HIV positive folks, we were seeing about 2% mortality a year, and now...
And that's huge.
It's huge, yeah.
I mean, the average person, I think, thinks 2%. That's not bad. That is actually, in public health terms, appalling.
It is, yeah. And now we're seeing, actually, it's not so much different, which is something that it's been actually very interesting to us that
and
now...
And by not so much different, you mean people who are not HIV positive are also dying?
Yes.
2% a year?
No, not as high of a rate, but the mortality rate is fairly high. I think last time we looked, it was still about 2%, a little bit higher for HIV positive folks, but we're losing HIV negative women too. And
There's a really complicated mix between domestic violence and substance use, in which people get so discouraged from the violence that they'll actually start using substances. And so sometimes people get hooked on drugs that they're also reliant on their partner for. So they'll get caught up in a very vicious cycle of homelessness, violence, and drugs that make it just all the harder for them to have a stable existence.
I was trying to think of an example that would translate well, particularly taking something like a woman who's struggling with addiction, which is not something that everybody can identify with. And I was thinking about junk food, right? Like that's something that many people can identify with, like the call of the French fries or the Big Mac, right? And how we can struggle with that, and we can try and make better choices around it and set up our lives in such a way. And I was trying to imagine sort of what the move between the streets and SROs can kind of look like for homeless women. And it's imagining that you're living outside of McDonald's on the street looking in, and so you have a little bit of distance, but you're still watching all the traffic, and there's still a tremendous amount of temptation, and then all of a sudden you're living in McDonald's, and that's the environment.
And you're hungry all
and you're hungry. You're starving, and there's so much fast food and the smell of it, and everyone's eating around you, and this is the environment. And that's sometimes the housing options that Elise is trying to allude to. So you really have to feel that and know that to then contextualize and say that doesn't mean that you can eat the French fries, or that if you do eat the French fries every day, that there's not a cost. The women that we work with articulate it in that way as well. They're very clear about there's not a sense of fatalism nor lack of responsibility for their behavior, but there can be a really clear sense of constraint and a real need and want for a way to lift those constraints so that the choices broaden.
And to give one example, a quantitative example, a few years ago, we published a study that showed the strongest correlate of incarceration for women in our study was homelessness. It was not drug use, it was not sex work, it was homelessness. And so, yes, the individual behavior is what brought that woman to become incarcerated, but what our data suggests is that that's happening in the context of homelessness. So homelessness is obviously influencing these decisions. Individual behavior is very important. But that we need to understand that choices and decisions are made in this context, these limited choices are made in the context of poverty, and that trying to have interventions or to help people either increase their choices or to have a better environment where they're doing that is not only going to be better for the individual, but it's going to be better for public health, it's going to be better for the taxpayer in terms of what we ultimately become responsible for later, and that it's not just that person doing well, it's really going to help on a lot of different levels.